begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now I'm taking a 1-episode break from emergency warning signs of COVID-19 to discuss an interesting and what appears at the moment a rare symptom of the coronavirus, which are mouth lesions. Now there's a study out which discusses COVID-19 potentially triggering the appearance of a rash inside of the mouth. Now, this appears to be an interesting symptom which could potentially accompany a litany of other symptoms of COVID-19, let's say such as cough, fever, difficulty breathing, and so forth. Now, we've all come to notice that the more time we've been with this novel virus, we began to notice there are other symptoms that present as well, such as loss of taste and smell. Now, can mouth lesions be considered yet another symptom of COVID-19? I say it's too early to tell due to the fact that individuals' mouths are not carefully inspected for this symptom, and there's still question as to whether these lesions are the result of being infected with the coronavirus or secondary manifestations of something else, such as, let's say, a reaction to a new drug or some type of systemic condition in which the patient is suffering from. Now, patients who tend to be suspected of having or have been confirmed as having been infected with the coronavirus do not have their oral cavities examined for the most part due to safety concerns. Now, there is some research to date that does note that mouth lesions can in many cases be tied to a viral infection. Now, the more common ones tend to have a petechial pattern to it. Now, this does not appear to be a symptom in which many are aware of, so I have not been questioned as to whether an acupuncturist can treat mouth lesions. And yes, in speaking for myself, I've treated individuals with mouth ulcers, and for the record, to avoid confusion, an ulcer is a form of lesion. Now, those that I have treated were not individuals who, at the time, had not tested positive for the coronavirus, nor had they ever been diagnosed as having been infected with this virus. I will say, a person can develop mouth lesions as a result of having been infected by an exterior pathogenic factor. In this case, in Chinese medicine, wind is one of the 6 evils. Now, wind, heat, as a warm disease can present with mouth lesions as a symptom. Now, in Chinese medicine, stomach heat as well as heart fire can cause mouth lesions, although the main organs that tend to be involved in this pathology include the spleen and kidneys, along with stomach and heart. Now, although the stomach, heart, spleen, and kidneys are the main channels involved in this pathology, other channels can be involved as well. Now, lesions on the tongue, which have been noted as a potential symptom of this virus, in Chinese medicine, lesions on the tongue tend to be related to the heart, spleen, and kidney channels. Now, when treating lesions on the tongue and have determined, let's say, the heart and spleen channel are involved, I would needle points on the pericardium and heart meridians to clear heat, and points on the spleen meridian to clear spleen heat and nourish yin. Now, in Chinese medicine, mouth lesions are generally due to heat with regard to this virus, wind heat. Now, there have been reports of mouth lesions on the tongue which have appeared to have a whitish rim to it surrounding the lesion with less of a raised edge. In Chinese medicine, that's an indication of an empty heat pattern, where I've encountered a case that presented as heart and kidney yin deficiency with empty heat. Now, in that case, I needle points on the heart and the pericardium meridian to clear heart empty heat and nourish yin, as well as needling points on the kidney and spleen meridian as well. And I also included points on the conception vessel to nourish the kidney yin. Now, I've even heard of a case where a patient presented with large red painful lesions with red raised edges and a yellow center, which is a sign of toxic heat. I've never encountered a case with such requisite symptoms to be diagnosed as toxic heat, but to speak blindly as if I did, depending on the patient's pattern, I could focus on needling points on the stomach and large intestine meridians to resolve toxic heat and clear stomach heat, as well as points on the pericardium meridian that works well at resolving toxic heat presenting with mouth lesions. Now, I could also look to nourish yin by needling points on the spleen meridian. Right now, this is too new to me as a symptom of coronavirus, but I'll reach out to some of my fellow acupuncturists to see if anyone has come across any cases of mouth lesions tied to someone having been infected with COVID-19 and get back to you guys. Now, if you were to find yourself as having developed mouth lesions, please, I beg you, please contact your physician immediately to discuss the matter. Now, don't forget to subscribe to my channel. And until next time, acupuncture is my life. What's yours?